Hello, this is Dr. Lewerenz, the Longevity Health Institute. So let's talk about something that I hear here every day, practically every day in the office with my patients, and that is why they have food cravings, why they can't get satiety, which is fullness and satisfaction with their diet, why they can't stop eating, and particularly what's really common is when they eat a lot of carbs or breads or starchy things, pastas, potatoes, rice, things like this, that they get this big, energetic or surge thing, but also a crash afterwards. And also particularly when people have a lot of processed, refined sugars or drinks or sweets or chocolates or candies or things like this. And maybe, our patients that come here are looking for health and wellness. They're not doing this every day, but realistically this happens and may happen more often than not. And they get these swings, these energetic swings and such, and they're always fighting the waistline, fighting the bubble. And this is some very, very easily understood and very scientific based stuff, but I can give you some tricks, some little tips and tricks that you can do that can tweak stuff in your diet and in supplementation and lifestyle stuff that can really make a huge difference at the waistline, but also at the energy demands. Meaning you'll feel better, you'll have more consistent energy and stamina, but you'll also not gain weight. So there's a few components to this. One is these big sugar and insulin and energy swings basically come from this. When you have a big bolus or a big glycemic load, whether that's fructose, which is the worst, but let's just say it's sucrose or glucose, sugars essentially, you're getting one thing, and that is a big surge of insulin. And when you get a big surge of insulin, insulin goes up to transport sugars to cells and into your liver, into glycogen and such. And what happens is that takes a lot of energy. So you get this kind of inappropriate or overstimulated energetic response from these sugars, but also there's a quick crash because actually it takes a lot of insulin to actually transport that stuff, and that ATP that's used in this actually causes you, which is ATP is energy, causes you to have these swings, okay? So a lot of it is based on this big surge of insulin, transportation of insulin and ATP, but also particularly this, sugar high, then sugar low effect, okay? Now, we'll get to the solutions to this, but this is one of the reasons. The other reason is that you hear me talk about the gut biome, the microbiome of your digestive system. It's your immune system. 70-80% of your immune system is your gut health. But also you hear me talk about leaky gut, permeability issues in the digestive lining, and these imbalances in good gut flora, okay? And making this sound straightforward and simple is this, is that you need billions of good quality bacteria. And you're always going to have about a small 5% amount of your normal gut flora is going to be yeast and candida. But again, if you have breakdown in the digestive lining and you're eating a high American refined, high sugar, high carbohydrate, high fructose corn syrup, all these sugars, and then you have a history of antibiotics, steroids, medications, stress, lifestyle things, essentially, you can break down your digestive barrier. And you don't have to just think about it right now. You have to think about what's happened in your life in the last decade or two or three or four, okay, that's got you here, okay? Saw somebody today that actually lived on, because of inflammation and pain, a lot of Motrin and NSAIDs for about 5-10 years, then actually had a bowel infection and colitis, ended up in the hospital on antibiotics, IV for about a week. Long story short, she's doing fine, came here for weight loss. We're working on health and weight loss with her, but her gut is a mess. And she just has a little bit of bloating in that, but she has leaky gut, a lot of candida, a lot of yeast, etc. Okay? When this gets due to leaky gut and in a permeability barrier in the gut, that yeast, that small part of your normal digestive flora, okay, that is candida, leaks in your bloodstream. And then if you're eating these high refined sugars and high fructose and sucrose and high carbohydrate diet, you're actually feeding the yeast. Yeast does cross the blood-brain barrier, and it tells your body to eat more sugar and have more carbs. We release a hormone because of this called ghrelin. Ghrelin just says, hey, let's eat, let's eat, let's eat, there's less and less satiety. So essentially, the consumption of carbohydrates and sugars cause you to eat more carbohydrates and sugars, okay? And obviously then there's a insulin swing, like I said already before, and a sugar plummet, and so we get mood issues and crashing grumpy issues and fatigue and just want to lay on the couch, etc. And we don't have this steady energy, but also you're causing a lot of caloric intake, a lot of carbohydrates, and then you fight the waistline, you fight the bubble, right? So that's another main reason. So one is the insulin effects, the sugar swings from insulin transport and ATP. The other one is your gut flora and having leaky gut and having too much candida or yeast that's actually leaking in your bloodstream and telling your brain to have, let's have more carbohydrates. And the third thing is something called ATP trapping. And ATP trapping is very interesting because it happens through particularly fructose. And you hear about the negative things, or at least you should know about all the negative things. Probably one of the worst things that you can consume out there in the world, in your diet, is high fructose corn syrup. And we all get it because it's hidden in everything. You can go to a restaurant, have good intention, order a salad, order a side vegetable that's steamed, and if you get a dressing that is on a salad, okay, and it's sweet or has anything sweet in it, unless you ask and you've seen the label, etc., you're probably getting some high fructose corn syrup. It's in a lot of sauces, a lot of dressings. It's very additive into things because it's cheap, it's refined, and it's very sweet, okay? It was brought into the industry, the food industry, in the 70s because of cost and all that, but the amount of sweet and glycemic in fructose, high fructose corn syrup, is astronomical. The thing though is we don't process fructose in our body well, okay? We don't digest and break this down into our cells well. So when you eat fructose or high fructose corn syrup, which is in like ketchups and sauces and Cokes and candies and chocolates and pastries and all these things, and especially in restaurant foods, okay, you're not breaking this down and bringing this like a sugar you would normally would and have the normal effects, okay, of sugar in your blood or in your body, excuse me, but you're actually getting this trapped in your liver. So it gets cleaved off your sugar, this fructose, and in your liver, it causes a lot of ATP to be working on in these enzymatic reactions in the liver, okay? And that's why they call it ATP trapping, because ATP is energy. And then there's a signal that sends up the vagal nerve to the brain that says, hey, even though we just had this big bolus, this big amount of fructose, okay, and we should have energy from it, it actually tells our brain that we need more energy, so we need to eat more. So there's this vicious cycle that just keeps happening because of this ATP trapping. There's a lot of negative things, and too long to get into here, that happen with fructose and high fructose corn syrup. It is terrible for you. In fact, actually, it's very, very linked to, in studies, many studies, that high fructose corn syrup is linked to non-alcoholic fatty liver. I'm sure you hear me talk about this. Epidemic rates of non-alcoholic fatty liver here in our country. I see it in the office here every day. Probably order 5-10 ultrasounds on people on their livers here a week, just because we're seeing so many elevated liver enzymes, and that is not normal. You're not born with elevated liver enzymes and fatty livers. Fortunately, that can be reversed. But you need to get off high fructose corn syrup. You need to look at labels. You need to go to restaurants, and I guess if it's your salad, just have vinegar and oil, okay? But good knowledge and education will give you good intention and then a result, okay? So hopefully that enlightens you on this. And what is the hack? What is the way that we kind of mitigate some of this stuff? Well, obviously you have to have some purpose and try to avoid this stuff. But high quality probiotics will always beat down bad flora in your gut, beat down yeast, beat down candida, and you'll have less of that grenulin telling your brain, let's eat more carbs, okay? We use, and you can go to our website or pick up in our office here, high quality probiotics. I like them to be live, whether they're in the refrigerator or not, individually packaged. I like them to have Saccharomyces boulardii in them. I like them to be in the 30 to 50 billion per count. We give you good instruction here. Again, you can go to our Carewell website, warehouse, and order a good quality probiotic on our website, longevityhealthinstituteinc.com. And on our warehouse, actually, you can put in password is health, HEALTH, and we have a multitude of very good high quality probiotics But good probiotics will always, medical grade GMP probiotics will help you beat that bubble and that craving for carbohydrates. Okay, obviously you have to have intention to eliminate high fructose corn syrup, less sugars, including fruits, limiting your fruits down. Okay, definitely gluten free, but not a lot of gluten alternatives that are all rice and potato based, because those are carbohydrates. Okay. And the other thing is that do your best to avoid high fructose corn syrup. There's so many negative things that happen with high fructose corn syrup. It's really causing an epidemic of obesity, type 2 diabetes, and fatty liver in our country. So hopefully that helps and enlightens you and educates you a bit on how to, if you will, avoid some of the mistakes that we get with these sugar swings and energy swings. Get off a lot of your carbs, high quality proteins, balanced diets, Mediterranean blue zone diets, high plant-based diets. I love, okay, but you got to have enough protein in your diet. But you want to get off all these carbs, and you want to have good gut flora, okay? And if you have any digestive symptoms like bloating, heartburn, IBS, constipation, diarrhea, mucousy stools, bloating, belching, etc., come see us here at Longevity Health Institute, because we'll fix your gut. Guaranteed, we always do. Give you answers, okay? Me and my practitioners are very, very dedicated to look at gut health, because I really believe it's the foundation and core of many of our systems in health and wellness and prevention here. So anyway, I hope this educates you. Dr. Lewerenz, Longevity Health Institute. You've heard me say it before about being well, being grateful, and living purposefully. If you need any of those supplements I mentioned on our website, all medical grade, all GMP, high quality standard stuff. That's on our website. You can order by using the password health, shipped directly to you. Actually, if you order more than $100 worth of supplements, free shipping. And again, we're happy to see you here and give you an answer to any of your even serious chronic conditions, because we always look at you in a personalized, individualized, functional way, and that's the only way to be looked at medically. So be well. This is Dr. Lewerenz. Take care.